Okay, let me see. Okay, it's starting.
Hi Gina, I'm Grainne. You were asking me about the Betalains. They come in a very tiny capsule like this. This is a week's worth of Betalains, and you take 2 capsules a day. There are about 400 to 500 beats in each of these capsules. The sugar is removed, and what remains is the Betalain, or the antioxidant, anti-inflammatory properties of the beets. And each one contains 70 milligrams of this. And by taking these twice a day, half an hour before meals, with water, you can address all sorts of problems like high blood sugars, osteoarthritis, the discomfort from it, not curing the bones, but helping with the discomfort, a lot of joint discomfort, flexibility issues, many of these. Women's health issues are a big thing, and we have 2 doctors that help with the company and use some of our teaching tools. There's Dr. Norman Raymond, who is a certified OB/GYN and anti-aging and functional physician. He's certified in the States and works at Ohio State University. And Dr. Phil Marini is a plastic cosmetic reconstructive surgeon. He does microsurgery, a lot of hand work, and he is fellow both in Canada and in the States. They are proponents of this and just think it's a wonderful product. There has been a research study done, and it's the influence of betalain-rich extract, which we have in the capsules, on the discomfort associated with osteoarthritis.
Okay. Sorry, I'm just gonna just
See if you can get in there.
yeah, so that people can see this if they want to check it out and learn more about the products and services that you have to offer. There we go.
That's good. It's a small study. The number of patients were only 28. It was conducted in Poland, but the good thing about it was that it was a double-blind placebo study, and without exception, there were 122 patients that said if the Betalains did nothing else, they got a real increase in their energy levels and their ability to do things. Within the study, and I won't go into it in great detail, they also talked about the discomfort levels and the joint functional ability, and they found that there was a 47% increase, which is almost as good as some of the pharmaceuticals.
Right.
So the nice thing about this product is it gives people options. They don't have to take a pharmaceutical. They can use an all-natural product.
Right. So I have a question.
Yes.
I wanted to know, based on studies or just based on experience with some of the clients that use these products, when can they start seeing results? Or does it depend on the condition and so forth?
It depends very much on the condition of the client. We find that people who've got chronic fatigue syndrome, or lupus, or what's the other one I'm trying to think of?
Crohn's disease, maybe?
No, it's not. I'll tell you in just a fibromyalgia.
Myalgia, okay.
Fibromyalgia. So, and women seem to suffer from that a whole bunch
Yes.
more than men. Though I know a couple of men who are on this and have had wonderful results. For whatever reason, those people seem to respond a lot faster than some people who've had a long-term arthritic or osteoarthritic. Having said that, there's a lady in the booth today that after 2 weeks had wonderful results.
Okay.
I myself, it was 7 weeks with my hip,
Wow.
which I thought was amazing. physician.
Oh, okay, your husband's a doctor.
He is a
I
doctor.
see. Okay.
He was very reticent about taking this, but he's had a fair amount of back discomfort and a lot of injuries from his sports.
Right.
So now we're
Right.
getting older.
Older.
He's paying for it.
Exactly. My father, it's the same thing. Issues with his back from an injury he had as a kid when a group of them were on a roof thing trying to watch some sort of concert. And so this is good to know. This is good to know.
And I just said to him, stick with it.
Right.
9 weeks. The pair.
This is a video.
The pair of
My
us,
BlackBerry.
the pair of us went out and fenced a third of an acre with metal
Right.
fence, poured cement, and we were none the worse for wear. And that was 3 weeks ago. And my husband said to me, I can't believe I did that. I have not done this before in about 5 years.
Now, how long was he on the products?
9 weeks.
9 weeks.
9 weeks.
Now, is there any roundup things that you may want to say? I wanted to keep it short and sweet so people will actually.
At it.
Yes.
I'm a nurse.
You're a nurse, okay?
This is way out in left field for me.
Right. So
And
from
I-
traditional medical model tradition.
That's right. I am so happy that I have done this because it's giving people an option and it works.
Okay.
And it's all natural without any side effects.
Good.
That's what is wonderful for me.
Right. That's a good final point because there are a lot of medications that are out there that seem to more mask the symptoms and not get to the underlying condition. And then there are also harmful side effects. So I think this is a good way to empower people.
Absolutely. And I think the really good thing is that it's one very simple product
Right.
with only one thing in it, Betalains.
Right.
And no side effects.
Excellent. Well, thank you very much for sharing your time. And people can check you out. Is there any additional information specifically you would like to give to people?
So much information that I can give you, and I think the best thing that I could do is give it to you.
Right.
And I would be very happy if you could continue to share it.
Okay.
And I am certainly accessible. You can call me anytime.
All right. Excellent. Thank you so much.
Thank
Take
you.
care.
Bye-bye.
Bye.